go our final lecture today, I coordinately invite Dr. DEVANAND JHA, Consultant ENT Surgeon.
Thank you for having me here. It's a pleasure to talk to all of you about the ENT problems at Lanka Hospital. ENT problems. Welcome to Lanka Hospital. Ear, nose, and throat problems are very common in our society, and it's important for us doctors to educate our patients on the importance of getting your ear, nose, and throat disorders treated by the ENT surgeons. Most of the patients actually, their first goal is to go and see their general physician, and in most instances, it's the general physician who tends to make a diagnosis and give a treatment. But sometimes that may not be enough, and it is very important that you see your ENT surgeon such that he can diagnose your problem and give you treatment accordingly. Now, there will be a few things I'll be talking out to the people at large for which, they have to bear these things in mind. The most important thing I wanted to talk about is that the ear disorders have to be taken very seriously, because ear disorders are something which are a little difficult to diagnose, and the general MBBS doctors may not be so trained to see the problems in the ear, and hence in most instances they would be giving you antibiotics or ear drops or some painkillers just to tide over the current problem. But it is very important to make a diagnosis first, and to make a diagnosis it's important to go to an ENT surgeon who would make a diagnosis. Now, at Lanka Hospital, we have a state-of-the-art equipment. We have everything that you can expect from an OPD setup. It's a world-class setup. We have a German machine with which we diagnose the disorders in the ear, nose, and throat area. So the foremost thing is we make a diagnosis first. And once you have a diagnosis, then we give treatment accordingly. The treatment can be a medical treatment, or treatment can be surgical treatment. Now, there are certain conditions which need immediate treatment, and those conditions are called acute treatment, or acute symptoms which the patient may present. You have to diagnose and treat them very quickly. For example, there are patients who may have a sudden sensorineural hearing loss. Now, in most instances, that may be perceived as a block in the ear, and one may think of it as being a very innocuous condition, maybe some wax in the ear which may have shifted. But the fact of the matter is that a patient may have lost his hearing for good. And if we institute treatment as soon as possible, then there's a good chance that the hearing can come back. So one take-home message I would like to convey to our public at large is that any ear disorder, especially a block in the ear or some ringing in the ear or dizziness accompanied by a hearing problem, should be taken seriously. Very rarely these problems can mean brain problems as well. The second is an ear discharge. Not all ear discharge are innocuous in nature. Many of these ear discharge may actually be due to very sinister problems. For example, you can have diseases in the ear which have a propensity to go to the brain. And hence, it is very important to get an early diagnosis made such that the treatment, which is usually surgical, can be instituted immediately. The third thing I wanted to talk about, especially related to ear, is diagnosis of children who are born deaf and dumb. Now, in the olden days, when children were born deaf and dumb, there was actually no treatment, and we would consign them to a future of no hearing and no speech. Thankfully now, we have state-of-the-art equipments in this hospital, we have state-of-the-art treatment in the hospital, and we have been doing something called cochlear implants in this particular hospital since the last 16 years. We have been pioneers of doing this particular surgery. wherein children who are born deaf and dumb after surgery would have the ability to speak normally, to hear normally, and be active citizens of the society. Cochlear implants done at the right age have huge benefits. They can be as normal as any child who is born normally. So it is very important to make an early diagnosis such that we try and diagnose children who are born deaf and dumb, preferably below the age of 1 year, such that the implant can be done at the age of 1 year. Now, in our hospital, we have something called a newborn screening program, wherein every child who is born at Lanka Hospital, we screen the hearing of the child to see whether the child is hearing or not hearing. And if there's any doubt about it, then we go ahead and do further specialized tests to accurately diagnose the hearing problem. So that is about the ear. Now, in the nose, actually, there are very many conditions. A nasal block can just mean maybe a bit of a swelling in the nose. An allergic rhinitis is a very common problem. So general physicians usually would give tablets, would give steroids, would give antibiotics to try and treat the blocks in the nose. Now, blocks in the nose can sometimes mean very serious problems. You can have tumors or cancers in the nose, and which a general physician or you as a layman may perceive to be maybe some phlegm in the nose. So not all blocks are phlegm. You can have major problems in the nose, and not all major problems cause headache or bleeding, which may alarm you. They can just be present as blocks in the nose, and hence, if there is a nasal problem, get a diagnosis made. You may need to get a biopsy done such that we can conclusively prove what is the nose problem. The third thing I wanted to talk about is the throat problem. Now, throat problems also can manifest in many ways, especially if a patient has been smoking and has had hoarseness or a change of voice. A change of voice is, in most instances, perceived as a phlegm problem, that I have possibly phlegm in my throat and hence I'm not able to speak very clearly. Hoarseness or change of voice can also mean that you may possibly have a cancer in the throat. So hence, it is very important to go to your ENT surgeon, get a diagnosis made, get a biopsy done, and then see how it is. Now, ENT is not only limited to ear, nose, and throat. We are also head and neck surgeons. We are also skull-based surgeons. Now, each department or each specialty tends to overlap with other specialties. So we work in conjunction with neurosurgeons, we work in conjunction with maxillofacial surgeons, general surgeons, pulmonary surgeons, because our area encompasses from dura to pleura. So whatever diseases are there, we tend to work, and sometimes we tend to work in tandem with the specialties of other departments. So my take-home message to the public at large is that ear, nose, and throat disorders, however innocuous, however less problematic they may sound, please get a diagnosis done, please get treatment done as soon as possible, such that you may have a healthy ear, nose, and throat area. Thank you so much.